Deciding between IUI and IVF is one of the most significant choices you'll make on your journey to parenthood. It's not just a medical decision. It's a choice that impacts your body, your finances, and your emotional well-being. Are you looking for the simplicity of a boosted natural process, or do you need the high-tech intervention of the lab? Today, we are breaking down everything you need to know to move forward with confidence. Intrauterine insemination IUI and in vitro fertilization IVF are both pillars of reproductive medicine, but they work in fundamentally different ways. IUI is often called artificial insemination, where the goal is to help the sperm get a head start. IVF, on the other hand, is much more involved, taking the entire process of fertilization outside of the body. Understanding these differences is the first step in navigating your fertility roadmap.
Welcome to Health 600's Noble Science in 600 seconds. Your life-changing 10 minutes. Let's go!
Chapter 1. The Fundamentals of IUI, intrauterine insemination, or IUI, is often the first line of defense for couples facing unexplained infertility or mild male factor issues. The process is relatively straightforward and mimics natural conception, but with a strategic advantage. It begins with washing a sperm sample to concentrate the healthiest, most motile sperm into a small volume. During your peak ovulation, window often tracked via ultrasound or blood work, a clinician uses a thin, flexible catheter to insert the sperm directly into the uterus. By bypassing the cervix and shortening the journey to the fallopian tubes, IUI increases the density of sperm available to meet the egg. It is a quick, non-surgical procedure that requires no anesthesia and carries a lower price tag than its counterparts. Because it relies on the body's natural ability to fertilize the egg and implant the embryo, it is considered a less invasive nudge toward pregnancy rather than a total takeover of the reproductive process. Chapter 2. The Complex World of IVF, in vitro fertilization IVF is the gold standard of fertility treatments, offering a level of control that IUI cannot match. The process is a multi-step marathon that begins with ovarian stimulation. For about 8 to 12 days, you take injectable medications to encourage your ovaries to produce multiple mature eggs, rather than the single egg produced in a natural cycle. Once the follicles reach the right size, you undergo an egg retrieval, a minor surgical procedure performed under sedation. This is where the in vitro Latin for in glass part happens. In the laboratory, embryologists combine your eggs with sperm. In many cases, they use intracytoplasmic sperm injection ICSI, where a single healthy sperm is injected directly into each egg. Over the next 5 to 6 days, the resulting embryos are monitored as they grow. This stage allows for. While the process is physically demanding and involves frequent clinic visits and hormone injections, it offers the highest success rates per cycle of any fertility treatment available today. It essentially replaces the natural wait and see of the fallopian tubes with a highly controlled, scientifically monitored environment designed to optimize every possible variable. Contrast, IVF success rates are significantly higher, often reaching 50 or more for women under the age of 35. However, these statistics are not one-size-fits-all. Success is heavily dictated by maternal age and egg quality. For women over 40, IUI success rates often drop to the low single digits, while IVF, especially when paired with donor eggs or PGT testing, remains a viable path. It is also important to consider the cumulative success rate. While IUI is less effective per try, some patients prefer the lower-risk approach of multiple IUI attempts before committing to the intensity of IVF. Ultimately, you have to weigh the probability of success against the time you are willing to spend in treatment. If time is of the essence, the higher per-cycle success rate of IVF often makes it the more efficient, albeit more intensive, choice for achieving a successful pregnancy. Chapter 4. Cost, emotional toll, and timing. The choice between IUI and IVF isn't just a medical one, it's a lifestyle and financial commitment. IUI is significantly more affordable, typically costing between $500 and $4,000 per cycle, including medications. This makes it accessible for many who are paying out of pocket. However, because success often requires multiple attempts, the costs can add up over time. IVF, however, is a full-body experience. The daily injections can cause bloating, mood swings, and fatigue. The emotional wait during the lab phase, waiting to hear how many eggs fertilized and how many embryos made it to the blastocyst stage, can be grueling. This Hunger Games of embryo development creates a unique kind of stress. Timing is also a factor. An IUI cycle follows your natural rhythm fairly closely. IVF requires a setup month, often involving birth control to quiet the ovaries, followed by the stimulation phase, and sometimes a frozen transfer cycle which can push the actual pregnancy attempt back by several months. You must ask yourself, what is my budget? How much physical strain can my body handle right now? And how quickly am I hoping to conceive? For some, starting with IUI provides a gentler introduction to the world of fertility. For others, the all-in nature of IVF feels like the most proactive way to take control of their future, despite the higher hurdles. Balancing these three pillars, finance, emotion, and time, is key to choosing the path that won't just get you pregnant, but will keep you whole throughout the process. Chapter 5. Making the final decision. So how do you decide? The answer usually lies in your diagnosis and your doctor's recommendation. If you have open fallopian tubes and a good egg reserve, starting with IUI is a logical, less invasive first step. However, if you're facing severe male factor infertility, bilateral tubal blockages, or have had multiple failed IUI attempts, jumping straight to IVF might be the most effective use of your time and resources. Don't just watch, take action right now. I have already shortlisted the exact products and tools you need to secure your results. Scan the video description below to get your protocol hardware today.
This is Health 600s, and I'll see you in the next 600 seconds.